Hello, I'm Dr. Donnie Altman, the designated institutional official for Willis Knighton Health. As you consider your future residency training, it is important to think about what you want from a residency program. Sure, you want the opportunity to expand your clinical knowledge and skills, but where you choose to train is an important step in your future career goals. Since 1924, Willis Knighton has grown to become the largest healthcare provider in North Louisiana. Our community-focused mission and an innovative, centralized approach to quality healthcare has made us the choice of consumers, attending physicians, and resident physicians seeking unparalleled training experiences.
Willis Knighton is the largest provider of medical care within Northwest Louisiana. As such, it provides primary, tertiary, and some quaternary care to patients from our area. And we have a faculty that's very committed to education.
We have very seasoned faculties who have played a major role. Leadership at national, international level. They are very productive in academia. They do very complex surgery. So we do have very comprehensive, well-trained faculty who really have a strong desire to continue to teach the younger generation.
I think Willis Knighton has the opportunity to give you a very diverse training in many different types of surgery, and not just many different types, a very deep experience with that, meaning you're not just going to do a hernia or a gallbladder, you're going to do a lot of really difficult hernias and a lot of difficult gallbladders, so that when you go out into practice, you've seen this so many times, you feel comfortable taking care of it with your, on your own. That's the real goal of a training program, is if you can take somebody out of medical school and over the period of 5 years, teach them to be comfortable, not just proficient, that's always important and competent, but they need to be comfortable doing that. And I think that's something that we have that is very special, because we have a large number of cases and you have a lot of one-on-one time with the attending.
There is an art to surgery, and I think exposing them to that knowledge piece and that art piece, and then showing them how it all fits together, is really cool. And it's something that you just have to experience. Willis Knighton's GME program is just the right size. It is big enough with a large enough volume that you are well trained when you finish. It's not so big or so inefficient that you're just steamrolled by the pathology. It has an atmosphere which is very collegial. The folks in the Shreveport area are very nice. It's just an ideal place to learn.
Minimal invasive and robotic surgery is the future of surgery. Why not gain that experience during your residency training? Our goal is to really get these younger ones engaged from get-go with both robotic and laparoscopic simulation, so that as they learn this, they'll be permitted to actually go to OR and do these cases, because they will not be training in patient, they already have done training in simulation.
Our institution currently sponsors residency programs in internal medicine, general surgery, psychiatry, oral and maxillofacial surgery, and rural family medicine, with over 70 residents training across all of our programs.
And the one thing that really stood out to me about Willis Knighton is it doesn't matter who you're going to run into in the hallway, in any kind of clinical setting, anywhere on any campus, everybody wants to do their job and they want to do a good job at it. And I think that that's really part of the special magic that sets it apart from everywhere else.
The mentorship model that we have is really amazing, because the attendings know us, they know our strengths, they know our weaknesses, and they help to build on that to get us to where we are confident what we're doing, our surgical techniques and patient care.
We have open surgery, we have robotic surgery. We're very heavily on the robotics. We have the Da Vinci 5 system. We have most of our operating rooms are dual console, and that's a great learning experience, because whenever you're dissecting out things, the attending can take over for a second, lead you in the right direction, and then it's instant transfer back over to you. So it's an easy transition, and it's operative exposure unlike any other.
I would say it's probably like a medium-sized town. And the advantage of that is that you have a lot of the bigger town amenities as far as places to go and eat and things to do on the weekends, but it's not so big that you can never get to those places. One of the things we like to joke about here is everything's 15 minutes away from everything else.
You're not coming to a place that has just big box restaurants. You're coming to a place that has some real next level restaurants.
I came to Shreveport, Bowser, because I love this community. During my residency, I got to know this community very well. I knew there was significant potential here. We always talk about Southern hospitality. I don't believe that you would find a better hospitality anywhere in Southern region outside better than what we have in Shreveport, Louisiana.
Over the years, Willis Knighton has demonstrated a strong commitment to medical education because you are the future of medicine. We want to help you expand your knowledge, reach your potential, and enjoy the advantages of being a part of our community in North Louisiana. We see your success as our success, and we're committed to creating a residency experience for you that will meet your goals. You are the future of healthcare, and in North Louisiana, the future of healthcare is at Willis Knighton.